Good afternoon, everyone. Everybody got good lunch? Feeling full? Not too full, not too sleepy? Yes? Bit of a cheer? Show me you're awake. Hello? Yes. So we're delighted to be able to share with you a worldwide perspective. We have representatives from organisations from all around the world. Very much looking forward to hearing more about what they've done, and so that we can all learn a little bit more. We have an incredibly wise panel. I'm very much looking forward to the next 50 minutes or so. But first of all, would like to ask each of our panel members to do a brief introduction. So if you don't know them, you soon will. Oh no, you shouldn't be.
Hello, everyone. I'm Janet Long. I am the Director of Research for the U.S. Hereditary Angioedema Association. You can read for yourselves on the screen some of the information regarding the U.S. patient group. We are proud of our U.S. HAEA Angioedema Center at UCSD that Dr. Zura spoke about earlier. But we've been asked to let you know something you may not know about our organization. We just reorganized into 4 pillars, and they are HAEA: health, advocacy, engagement, and advances in research. So we're excited about this reorganization for ourselves as a patient community, to be specific in our focus in what we want to achieve for patients and families.
Hi everybody, I'm Fiona Wardman, the CEO of HAE Australasia. We look after Australia and New Zealand. We have a unique situation where we do have 2 countries that we obviously represent and advocate for, and both of those countries do have very different health regulations, and we have a situation where there are treatments in one country and not necessarily the same in the other. So that's some of the hurdles that we have to cross.
Hi everybody, my name is Jørgen Schultz Boysen. I'm a treasurer of Bangalore's HAE Scandinavia, and also executive committee member of HAE International since 2011. Debs, I don't suppose we could put the FA Cup final on there, could we?
I think Royal Wedding? No?
Okay.
FA Cup final?
No, I would love to tell you about Scandinavia. As you know, Scandinavia consists of Norway, Denmark, and Sweden in this setup that we have here. It was established in 2014, and as it says up there, we established HAE Denmark in 2001, so a rather long history. We have around 360 members in the 3 countries, obviously widespread, as geographically there's quite far between both cities and population, so you can also see the amount of areas that we have, or centers that we have. Obviously bigger in Sweden and Norway, or a higher number, but in Denmark we have 1 center. Scandinavia is sort of the nirvana of HAE in the sense that we have from a treatment perspective. So of course we're very pleased of that, and that goes for self-administration, that goes for getting access to medication. Still, we have our struggles, and I think 2 major struggles are, 1, the continuous commitment among the patient group, simply because we are doing quite well. So it takes a lot to get motivated, and obviously we learned about that before lunch. And secondly, starting discussions of, can medication be paid for everyone, and so on. So of course we look into that discussion as well.
Hello, my name's Rachel. I'm a HAE patient, and I've worked with HAE UK more or less since the beginning in 2010. We started with just a handful of patients. We registered as a charity, and we've now got around 470 members. We've got 36 specialist physicians and 33 centres, and as you can see, we've got access to quite a few medications. We still find, though, that some patients who have infrequent attacks and have to attend A&E still have struggles with explaining what HAE is and people understanding. So one of the projects we're working on at the moment is working with GPs and A&E departments, trying to raise a bit more awareness of HAE.
Hi, I'm Jackie Badu. I'm the president of HAE Canada. What I would say we are, like we always say, we're basically, I'm a mom, and I'm a meme now, and we are basically patients and grandparents who are tirelessly working hard. We work together, we cry together, we hold each other up together. We are truly an HAE family. When we were first organized, it was under CHAS. The physicians and the patients were together in 2002, 2003. Then in 2010, we incorporated, and the patient group is separate to the physician group. The physician group is the Canadian Hereditary Angioedema Network, which now then they do the guidelines and the medical research part of it, which it makes us very fortunate to have them all. We have about 5 veteran physicians who everybody was known globally, and we have another 9 on the chain board, and we have another, I had written 35, as I was just told by Dr. Betchell this morning. Now we are at 45 on that list that are treating. So we feel our strength has been this. It's been what our physicians have done. We are very fortunate. They give very good care. We would say right now our biggest struggle is the burden of having to witness and watch the HAE with normal C1 inhibitor suffer. So we are very grateful for this conference, that it looks like there's things underway that are going to improve that care. Thank you.
Thank you. I think you already know who I am. We have, just to pick up on a couple of things on that slide, we have estimated 2,400 patients. However, at the moment, we roughly have about 470 diagnosed. However, if you consider that in the year I was diagnosed, 2012, we only had 80 diagnosed. So that's quite some feat that we've got up to those numbers in this short space of time. The other thing I'm very proud of is the data that I've used to fill in that slide. Actually, we have gathered ourselves along with the physicians and along with industry so that we actually have patient-generated data now that helps inform us about prevalence, severity, all quality of life issues. So I think that's something incredible. You'll be quite confused. We have 234 specialist physicians. That means that's the numbers treating. That actually creates a lot of difficulties for us because there's no centralization. We have no specialist HAE centers of excellence. We have a few physicians who are delivering excellent care, and we know who they are and we work together with them. But we have, I think, in my opinion, too many physicians treating maybe 1 or 2 patients, which means we have a lack of expertise in areas. We have 100 centers who are treating now. Now that is necessary because we can only gain treatment by going to a hospital. And so one of the things my organization has done is try to increase the number of hospitals that will deliver Berinert, the only treatment that we have for acute attack. So we've got a long way to go, but I think we've come a long way. Thank you.
Thank you. So this afternoon, we want to look at a couple of different topics and almost pick your brains about what you've been doing in your organisations. And I firstly wanted to pick up on patient organisations as a whole, and to come to you, Beverly, because I think you're the most recent organisation to have been incepted, registered.
Yeah.
What motivated you to set up an HAE organisation in the first place?
I think my son already outlined that.
Okay.
I mean, the feeling that, well, one, that I personally, after being diagnosed, after having a pretty horrific experience, and being an academic, I immediately went out and read a whole load of academic papers, which just scared the hell out of me. And I was calmed down by actually talking particularly to Anne Price in UK, and actually talking to other advocates, and then later Tony Henrik. And so getting a sense that we need an organization where we can work together to move ahead the discussion, move ahead with the treatment environment to support each other. So I had a very strong sense then, quite early on. But you can't do these things on your own. You've got to work. You've got to have other people who are also thinking the same thing. So we had some doctors who had already reached that point as well, of thinking we need a patient organization. And also industry partners as well were very, very supportive. So the important thing was to actually identify some patients. I had no idea where there were any patients. I was, you get this culture argument a lot in Japan, and it's one that I try not to take too much notice of. I was told no Japanese patients will ever step forward and show themselves. You'll never be able to set up an organization. So I said, tell me about it. It's going to happen. And so the first thing was to identify patients. So I worked, as my son said, with Tony, Henrik, HAI, with some industry partners to get two big meetings going, one in Osaka and one in Tokyo. And we were all astounded. I think the Tokyo meeting was first, if I remember rightly. And as soon as we got to the Q&A time, there was all these people putting their hands up, including Imamura-san over there. Do you want to stand up? Right, thank you. And when I said, is there anybody out there who wants to help me start an organization, she immediately said yes. And then in Tokyo, we had Matsuyama-san. Is Matsuyama-san out there? Yeah. And again, immediately said, yeah, I'm willing to help. So immediately we had a team of 3. And it wasn't too difficult after that. Yamagishi-san, Takagishi-san, all sorts of other people helped and came together. So I'd like just to indulge myself for a minute and ask them all to stand up, because we have all the Japanese members. Eugene and Shia as well. Yeah. So this is a culture where I was told no one will show themselves, and here they all are. And if you look at our website, you will see that all our members now, we have lots and lots of positive images of us doing things together. People have been willing to show themselves. And I think once you get that core group, we quickly got a core group of 10, which was needed to start up and register ourselves as an organization. And we quickly got non-profit status. Very, very grateful to CSL for helping us with that, because the paperwork was horrendous and we'd have found it difficult on our own. So I think you do need to work with industry partners. I think it is good to get an official status, a non-profit status or whatever. The non-profit status means in the Japanese context, we don't have to pay tax, which is very, very important. It means we can use everything we get for our advocacy work. So my advice would be, yeah, you get your core group. We work from that core group of 10. We're now up to about 63. One after another, we get more people who are willing to be involved, willing to do things. And the more that people see the positive benefit of taking that risk of disclosing themselves as a rare disease patient, the more other patients will come out once they see the benefit there. And I think the risks in Japan are still real. I think there is discrimination around having a blood hereditary disease, but we can overcome it, and we will overcome it together. So thank you.
Oh, brilliant work, Douglas, brilliant. So we talked this morning, and it sounds like it happened here. It started with you, the one person, and you found other people, and the ball was rolling, and now it's unstoppable. But Jackie, when you were doing your introduction, it sounded like you had a slightly different route to becoming a patient organisation, and that it was you were part of the doctors' organisation. Was that right?
Yes. We were together with the physicians and the patients. And then when we incorporated into just being the patients, I began as the regional director for Manitoba and Saskatchewan, and I was on the finance committee, and if everybody knows me, that's my least interested area to be in. And I was also on the bilingual committee, is how I started. Then went on to being the president of HAE Canada. And what we have unique is the relationships we still have as our regional directors are very linked with our physician centers, which are so nice. We can't say they have the designations of centers of excellence, but they are all functioning like that. They already occur, and we are very fortunate to have them all. We have veteran, seasoned physicians, I don't know politically correct term, Dr. Tom Bowen, Bruce Ritchie, Dr. Richard Warrington, Dr. Gordon Sussman, Dr. Jacques Ebea, and Dr. William Yang. And volunteering with that also is our nurse, Stephanie Santucci. Also, we have 9 on the Canadian Hereditary Angioedema Network on the board, which is Dr. Rizita Bariza-Meza, Dr. Christina Kalasinski, which is my physician, and being an HAE with normal C1 inhibitor, and my family is very fortunate because we can text them on their cells and they will, any ER anywhere globally can access them because we can't carry all our medications yet. And Dr. Amin Kanani, Dr. Paul Keith, Dr. Susan Wasserman, Dr. Gina LaQuesta, Dr. Christine Muscusker, all being led by Dr. Stephen Betchell, who is the chair and of CHAIN. And then they have the care closest to home, which these physicians, we were at 35 when I did this, and now we're at 45. But they collaborate and coordinate the care through them, but we get it closer to home. So that's where I find that that's where we're unique, and we also are what Tony always calls me, HAE Canada International, because we are such a diverse cultural country that myself running is similar to him running HAEI. So we have Canada, and I'm the president of HAE Canada, and we have Charles Saint-Pierre, who's the president of AOHQ Quebec. So, and we collaborate together, but we are very diverse in our culture and very uniquely different with every province, and we have 2 different healthcare systems. Thankfully, we have Canadian Blood Services. When products go through there, it goes through all of Canada. But if a product goes through the other system, like the Pfizer, I had to navigate each and every province, and each and every province made a different decision. So we are very uniquely different that way. So fortunate for who we have. And I'd also like to take the time right now to have the HAE Canada team stand up, and that's also with our sponsors, our physicians, and that's our HAE Canada team.
Thank you, Jackie. So it sounds like very different experiences, obviously very different countries and cultures and organizational structures, but both organizations going really well. To come to perhaps Rachel and maybe Janet about not necessarily the practicalities of setting up an organization, but what is it to you? What is important about being part of an organization? Why should people join?
Well, me personally, I think is support from other people. I think a lot of our patients they've never met anybody else with HAE. And we organise a patient event once a year. And our feedback from this event every year is, I've met somebody else who knows how I feel. And it's life-changing. And I think just knowing there's someone else out there that you can talk to, you can meet up with, it's that opportunity which comes as part of a patient organisation that you can put people in touch with each other, not only for me with people in the UK, but at an event like this worldwide. It's just nice to network and people understand. You don't feel alone.
So we've talked a little bit about there being one person, but connectivity sounds incredibly important. Janet?
I can echo everything Rachel has said about our organization as well. We often, all of us say, wow, it's so great to be in a big family of people who all understand us so well. But we find communication is also extremely important. It's helpful in this day and age of electronic information, social media, to keep patients connected this way as well. But we have our annual or every 2-year summit for patients in the US as well. We also, I think as an organization, are just very proud of being a source of unbiased information, a central place where patients can go and know that the information they're receiving is simply out of caring and compassion and sincere desire to help.
And what would you say has been your most rewarding experience about being part of a HAEA?
For myself, I think this is often true for probably a lot of the people here, but it has been being able to be part of something that I know will create a better future for my own daughter. She's my inspiration every day. And these children that you'll see here and the young people who are in the fantastic program that HAEI has provided, they are our future. And I think that's the most rewarding part, is just to see how much better their lives are becoming every day.
Yes, completely agree with that. Yes. And it feels like we're in a room of very motivated and very people that want to be able to make a difference, want to come together, want to be able to share experiences. But there might be some people out there who aren't part of an HAE organisation. What would you say to those patients to try and encourage them to be part of our family? Rachel?
Do some research, I think, and look at the different organisations, see what is available. Like Janet said, look at all the new treatments that are coming out. Life is going to be different for people in the future with HAE, so being part of an organisation, I would encourage people to do that so they can be part of trials, they can meet and network with other people, find out how people deal with having HAE, and again, realising you're not alone.
Thank you very much. So we've talked a little bit about setting up organisations. We've talked a little bit about the importance of being part of a group, what we all get out of it, what we want to be able, how we want people to feel as being part of a group. But another aspect of the work that you all do is raising awareness. And this includes organising things and organising lots of different types of things. So we've called this Organising Anne, because we want to talk to a couple of the members of our panel about different types of activity that they've organised. And firstly, I'd like to come to you, Fiona, because you've talked about using an awareness event in order to raise awareness, but particular an experience with the media. And could you just tell us a little bit more?
Sure. So this year we took advantage of Rare Disease Day, which is the last day in February, or 28th of February or 29th on a leap year. One of the issues that we have in Australia and New Zealand, we're very much behind the 8 ball with patients being aware that they have HAE, being diagnosed, knowing that we exist. So what we ran was a media campaign. We were able to get some funding from our partners, our pharmaceutical company partners, that we are very fortunate to work with very well. And we found a very competent media communications company, and we engaged them to reach out to the media. We're not media experts, but we had to do some background work. So what we did was we got some of our very brave, or we put a call out to our very brave patients and carers out within Australia and New Zealand, and asked them if they would, be happy to share their story. And as we know, it can be a very personal thing, can be very confronting, but we had quite a few people step forward. So from our side, we coordinated that for the media company. They then did a follow-up phone call with those patients and carers just to make sure that they were comfortable and talk about the key messages that we wanted to get across on Rare Disease Day. Rare Disease Day, you're fighting with a lot of different rare diseases. Rare Disease Day, right? So HAE being a very small part of that, and there's 8,000 rare diseases around the world. So we just wanted to get a little bit of us out there, just so we could help find the rest of those patients that could possibly, we know that are out there, and have them come our way so that we can help them with support and education and making sure that they're being looked after in the correct way. So the media campaign ran. We had interviews with television, radio, newspaper, magazines, and all of that hit social media. We had a lot of hits. We had I can't remember the number, but an astounding amount of opportunities for people to read about our stories, which was amazing. So if you're interested, on our website, haeaustralasia.org.au, you can click on, just go to the, I think it's resources page, I think, or news, and all of those different interviews are listed there.
That's fantastic. I
Yeah.
mean, the media can be an incredibly powerful way to, with one activity, reach such a broad audience. And when you tie in social media,
Yeah.
do you think that there's somebody in Australia and New Zealand that didn't see it?
Well, we know there were. Well, I don't know if there was anybody that didn't see it, but we know that people came forward. In fact, the first story that ran on the Sunday morning in the Sunday paper, the major Sunday paper, I was contacted the very next day via Messenger on Facebook. So somebody found me. And I know that a couple of the doctors were also contacted from patients. Whether they have HAE or not is another story, but at least they saw the story, they had an opportunity to read about it and think about, is that my disease, is that what I have, and then know the right path to go to either find us or go to the right doctor to find out their condition.
And how many people have saw the campaign and come forward? You mentioned one almost straight away on Messenger.
Yes, I don't have all of the stats because if they've gone to doctors and they're not, in contact with us, then I'm not sure. But I know that Professor Catalaris that was here in the scientific track, she had, I think, at least 3. So we have 75% of patients that are either not in contact with us or potentially not diagnosed. So that's a lot of people we need to reach.
And with a rare disease, you're often sort of trying to find the needle in a haystack. So to have one contact you and know that your Dr. Catalaris has seen 3, that's fantastic.
Yeah. And use your friends to share the stories on social media because it just takes one person to share it with somebody else. And we heard from Rashad this morning where, one of his colleagues, the sister had HAE from the work that he'd done. So, one person might find out.
Yeah, the more that we can share the stories and talk about it and raise awareness, the more that we'll find some of the missing people that make up those numbers that we've been seeing today. Brilliant. Thank you very much, Fiona. Jackie, you and I had talked just a little bit about you've been involved in different types of events, more fundraising events. Would you be able to tell us a little bit about those?
Yes, we do patient events closer to home, which a physician comes and speaks. We have found, and sometimes we collaborate with other different diseases, so we've been able to do these events using our budget for about $2,000 to $3,000, and we actually have had to limit to not more than 40 HAE patients to accommodate, and we have linked it to an online when we get them and to our social media. And we are going to be commencing now putting fundraisers with these events. We have 4 or 5 of these as they occur, and they're very well attended. So this is how we're going to be going forward now. And we have some entertainers who have agreed to partner with us, and we will take advantage of these events. And by doing them with another disease entity, whether different disease states or organizations, then it also involves them wanting to help out and attend, and we also attend theirs, and it just all helps everybody out.
And how did you approach the partner, doing these events with sort of another rare disease state? Were you looking for similar physicians or?
Yes.
Yes?
It tends to be the physicians that collaborate those disease states, and depending how it is and depending the province, it's uniquely different.
Okay, thank you. And Rachel, coming back a little to awareness and the types of activities that can be done relatively simply, as I know, putting videos together, that's a spoiler, putting videos together can be more challenging than you might think they are, but we'll talk to you about your awareness raising video for HAE Day.
Okay. This idea started off by, we've got a youth ambassador called Alex, who in 2016 at our patient event Alex did a really good PowerPoint presentation highlighting some of the achievements of some of the HAE youngsters, and it had such an amazing reception by everybody that we thought about maybe we can enlarge on that slightly. So for HAE Day this year, we got together some patient stories ranging from the age of 6 to 87, and worked with a production company to actually put this video together. I think there might be a clip of part of the video.
Yeah, we can watch a clip. I think the guys will play it.
That was only part of it. You didn't see the middle section, which has actually got all the patient stories, a lot of which you saw the photos of there. One of them I'm really proud of is the 87-year-old, because that's my grandma. She learned to do icatibant injections only a year ago, so it's quite life-changing for her. So we wanted to use this video as a way of showing people that actually having HAE shouldn't stop you from doing all the things you want to do. Then we've got a ski instructor, we've got one of our members, Dana, who's here somewhere today, who climbed Mount Kilimanjaro. And we just wanted to use this as an opportunity to raise awareness about HAE, but in a positive light. So it took a bit of organising to do it, but we've got some brilliant members who are really happy to be part of it, and we think it turned out well. If you want to see the full video, you can. It's on YouTube. You can search for it, and it's HAE Awareness, My Perfect Life, and you should be able to see the whole video.
So I think your hit rate is going to go up by approximately 400, maybe?
I will say it was only released for HAE Day, and I think we've had about 600 hits already, so you know, I'm really pleased with that.
So Rachel, you mentioned there, you said it took a bit of organising. I wondered if I could ask you what the biggest challenge was. It sounds like there was a brilliant idea and you had motivated people. Was there, something that...
Well, originally, we'd spoken to lots of people and we knew that everybody has their own story. And when we thought about putting this idea together, I sent an email out to all of our members and said, there's an opportunity, we'd really like you to get involved. We'd really like to tell your story and show all these inspirational people. So we targeted people via Facebook and we got a huge response. Some people wanted to share their story. Some people felt they didn't have a story that they were able to share, but they wanted to be part of the video anyway. So yeah, most of it was done online and over the phone, and obviously people sent photos through, and then I went directly with the production company and sat with them and worked to put it all together. So it took a few weeks, probably 8 or 10 weeks to pull it all together, but I think it was a worthwhile project, and I think we're all really pleased with the outcome.
The outcome is amazing. I can't wait to go and look at the
Thank you.
full video. Yeah, well done. Fiona, in your awareness project, you were also working with patient stories. Did you have a similar response when you put the call out there, or because it was a one-to-one interview, were there a few more reservations? How did the recruitment go?
To be brutally honest, and you will find this, that you reach out and people say, yes, 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 I want to be a part of it. But when push comes to shove, some aren't comfortable, and that's okay. It's totally okay, because we all have our comfort zones, and if you choose not to, that's completely fine. But we do have, it's interesting because we did have some patients who were very, they're saying, you know, I'd really like to do it, but it's, you know, I don't like talking in front of a camera, or, so we did give them the opportunity to do print media only instead of video. However, we did have one or two patients that said, you know what, I can see the worth in this, so I'm going to push past my own comfort zone and go for it. And we've got some brilliant footage.
Yeah. Which you can use everywhere now.
Well, it's on our website.
Everywhere, yes. And the web address was again www.haaustralasia.org.au. Just saying. Jackie, you're organising a very different style of project. These are they're bringing people together and the fundraisers. Have you experienced any challenges, and how have you overcome those?
Obviously, when you put different groups together, comes with some added challenges. But I do feel overcoming those challenges are very good for the rewards that have come. Just to show the difference, as a group, we have different skill sets, so in our different provinces. So when you're looking at a media campaign, that's where we have on our board the Howlett family, who are more than willing to do the media and the different interviews, and the AOHQ Quebec portion, Michelle Saint-Pierre, they've done a lot of media coverage. We are basically running our organization with about 40 to 50 people with feet on the ground, but many want their anonymity still and do not want to be part of the PR coverage. So the ones on the board are willing to be part of the coverage and have their stories out there. So we're the ones who get our pictures taken, and in all honesty, if I wouldn't have taken my pictures with all the ministers of health, we wouldn't have gotten any of the medication in the provinces. That is entirely how we got the medications through. And like I said, different skill sets with this group that we have. Myself, although I am taking the pictures, I'm much more of kind of a sciencey, nerdy person, and I'll do it. And it's brought a lot to have it, and my past work experience gave me knowing some of them. But I guess, again, our biggest challenge in some provinces, some have been very strong in different ways, but so uniquely different. In the West, they've had to do a lot of advocating with their governments to ensure better access and greater access. Our media covers, like I said, Ontario and Quebec, they're the two largest provinces. So everyone's had their unique challenges, and we just try to collaborate along the way. And that, and the Maritimes, although but little, have a lot of heart and get a lot done. So we use those to our advantage when we're looking at where we're going to strategically put an event.
So it sounds like you're all making the most of the resources that you have, whether that be the ideas, that be the people, that be the physicians, it be skills. It's the connections, and it's knowing and motivating people to get the job done. Obviously, a lot of hard work along the way, but it's taking people with you. It sounds great. So moving on from talking about organising different types of event, and just a couple of examples there, we wanted to spend a little bit of time discussing collecting information, because we're sort of established and we're working as our organisations, we're raising awareness, we're finding the patients, but it's becoming more and more important to have patients be part of providing information to know how the treatments are working, what attacks are taking place, what the impact is. And Ewan, I think this is something that is a really big focus for HAE Scandinavia at the moment. Would you tell us more about that?
Absolutely. Yes, it is, and it has been for a long time, actually, as I started out mentioning, that even though in a country like Denmark and Norway and Sweden, where we do have access to all the modern treatments, and both for acute and prophylactic treatment. So we are very fortunate in that situation. However, we also see discussions coming up in the media and from governments that at some point you need to prioritize. Where do you spend your funds for what sickness or illnesses? So of course, for that reason, it is extremely important that we capture the data of when did we have an attack, when did we treat prophylactically, what impact did the treatment have, and so on. Both for understanding when was my last attack, how many attacks did I have for the last 3 months, 2 weeks, etc. When you speak to your physician about that, for the physician to be able to tweak your medication, your treatment, to see if you're okay right now. Should we try a different setup? Should we increase? Should we decrease? And so on. So because we don't want to over-treat, but we don't want to under-treat. So we want to treat right. And in that matter, of course, it's important to do that, because simply we want to hand over a better future for the kids upstairs than the one that we got. And that is continuing to have access to the medication, so that we can take control of our own HAE and live our normal life.
And is it that in perhaps Denmark, I'm not sure about the other Scandinavian countries, that there's an increased link to being able to get medication to actually, you have to provide information about how you've used the previous medication before you can then get your next prescription?
Yeah, it's when I sit down with my physician and walk through for a control session or check. What we do basically is we look at the attack calendar, not only the attack calendar but the treatment calendar, to see, did you treat the way we agreed? Did you how many attacks did you have, and so on. And there's no signed document in that sense that we have to, that you have to deliver the data in order to get your medication. But it is a very strong argument from the doctor's side, at least, that you need to give us back the data because we need to use this. But I don't only see it as information for the doctor. I use it myself, and I use it for my son to basically see, how did the last 3 months go? Did we and what were the reasons for that? Was it because of Christmas or birthdays or anxiety for whatever reason, and so on. So I think it's not only a tool for getting access to medication. It's definitely also a tool for looking back and evaluating, should we be doing something different in my own situation or my family's situation.
So a lot of very, very helpful information, and it sounds like there are key motivators for you and the other patients in Denmark to complete a diary or a calendar. But, for example, I know Beverly in HAE Japan, and you have been very active in bringing together a patient diary, but where access is not as easy, how are you finding patient diaries and collecting information, and what do you see as the importance of the information, particularly in the Japanese patient population?
Okay, well, we've only just launched an app which was a collaboration with Shire, and it's an app that you can use on your smartphone to record attack data, the sort of basic thing, number of attacks, location, severity, etc. But I think we approached the situation in quite a novel way. We decided to collect the data to create the app using an ethno-methodological approach. Sounds very long. Basically what it means is talking to the people who are going to be using the app. So what we did, and it was outsourced by Shire to a company, the company went around and met the different patients and asked them, well, what, given we want you to record every attack, what do you want to know? What do you want to know a month later about the attacks you had? What's important to you? So we went very much from the patients, and then it went to the level of the physicians as well. Well, what would you like to be able to see when a patient comes into the surgery to talk to you? So it was a very much a collaborative process, and at various stages the data was brought to myself, to Dr. Hide, Dr. Osawa, possibly some other physicians as well. We gave feedback on it, modifications were made, this went back to patients, regular patients who commented on it. So it was a real collaborative process. And the app was launched last week. I'd hoped to give some images, but I didn't successfully send them. But I think the diaries are important on several levels. One level, at the patient level, myself included, you can't always remember how many attacks you had when you had your attacks, but it's pretty important you do. And at meetings, it became clear when I had talked to patients, I said, do you report every attack you have to your physician? And everybody said, no, no. But it's actually pretty important that physicians know how many attacks you're having to fully understand the picture. And so it seemed important from that, but also understanding yourself. What are the risk factors? When am I having these attacks? Am I getting worse at the moment? Are things better at the moment? So from a patient perspective, it seemed important. Another thing, when patients go to see a physician, we found that a lot of patients feel inhibited to talk openly about how much, there's not enough time, they're not quite sure how assertive they should be. So if you can just say, look, this is my diary for the last month, this is my attack record, we thought there's a win-win situation there. Physicians also thought this would be very good. And there was also another reason, although the data's not linked up, it's not a registry, there's no linking of the data, so we would have to collect it later, but it opens up the potential to collect data about attack frequency that can be used for clinical trials, for example. It can be used to lobby with the Ministry of Health. We can collect data from a certain number of patients, say, look, this is the attack frequency. So we felt diaries were very, very important. On top of that, we wanted to get an ongoing collection of data that could be aggregated, so used generally. And so I've been working for a long time with Professor Kato at Osaka University to develop a Japanese version of RUDI, which was originally developed by Oxford University, and you may know RUDI. So that is a rare disease database that's patient-centric. So we have a patient forum. Imamura-san's on that patient forum. It's not just for HAE. And the patient forum drives the registry. I think we want to be involved in the HAI one as well, but for the moment we want to make sure we get some data before the treatment environment improves so that we can show the improvement when it takes place.
Fantastic. And another really important way, so patient diaries, I think, absolutely necessary. We need to have the information about what is going on and what medication has been used and how effective. Another really interesting way of collecting information are surveys. And Janet, I don't know if you know, Janet presented at the scientific track yesterday on some results from a US survey. Would you mind just saying a few words? There is a motivation perhaps to fill in a patient diary that there may not be to fill in a survey. How have you found working with HAEA members to conduct surveys and bring in survey data?
Sure. I would just echo what Beverly and others have said here about patient diaries first, in that we also have an app for the HAEA, and I would just add to it that it's also important information, crucial information. Data is so key to moving forward for HAE patients, not just for our own records, but for research in the future to help improve our lives. So if you're able to have a diary and use it for your personal use, but also to contribute data, that's a great thing. Surveys also contribute data, and often our organization is asked, because we have such a big country, we have a large number of members, we're probably the largest membership in the world, so often we are asked to provide surveys that can bring information about how products are being used, how effective they are. Sometimes pharmaceutical companies would like to know how you're doing, or if you would appreciate a different formulation of a drug. And what we usually find is we rely a lot on patient goodness of heart. So it's very important to be motivated, as the motivational speaker was saying, to do something good, and certainly to provide data in any form is just helpful not only for your future, but to make creative and positive changes for everyone. So if you can have that motivation to do something altruistic, surveys are another way to help us all kind of move forward.
Thank you. So we're coming on to our last topic. We don't want to stop you from being able to get out and get some more coffee, but we've got a couple of the HAI resources that members of our panel have used. So I thought this would be a great opportunity just to spend 1 or 2 minutes talking about the nuts and bolts of what happened to be able to take advantage of using that resource. And Jörn, I know you have been involved in HAI Connect. What was that like?
Yeah, as you say, we implemented HAI Connect, and as you all saw in your bag, just a small marketing piece for what that is. It was actually very easy to implement. It's an online database, cloud-based, so you don't have to host anything or build up anything. And you get a membership database where you put your members in and you can communicate with them, you can target them in terms of your communication. So if you want to talk to all your youngsters or you want to talk to a specific group for clinical trials, etc., you can find those people. So basically a good and secure, for the EU GDPR, by the way, database that holds your members, and you can communicate with them as a platform. So very easy to implement, actually.
And also really helpful in case there were any sort of issues that you needed to get in touch with people really quickly. You can pick who
Yes.
may be affected by that and send out an email. Is that
You
right?
just segment by,
Yep.
you have different attributes or knowledge about your members, and you can segment by that, and then you can find the 10, 15 people that you need to speak to immediately, and then you can contact them. Yeah.
So if anybody else has any questions about what it might be like to try and set up HAI Connect, Jörn is your man. And Fiona, I think you have the website.
Which I've plugged
Yeah,
unmercifully. Yes.
won't mention it again. Is hosted under HAI.org.
Absolutely, and this has only come about in the last 18 months, I think. We were hosted before, and actually our website was designed by a web design company who cost us a lot of money, or charged us a lot of money, to do, a good job. The problem was that we couldn't update what we needed to ourselves and in a timely manner. So it was brilliant for us when HAI said, here's the opportunity for a website, we'll host it. Ka-ching, that's no money to other people, that's money that we can keep. And I never thought I'd be able to update a website, but I do that now all myself. It's very easy. I've got support when I need it. I can update it whenever I need to. I can add stories and news and events. And obviously it's a great platform for patients out there who don't know about us. When they type in swelling, they may be drawn to us, so they'll find us. And from there also there's an online membership form that comes directly to us and gets fed into HAI Connect as well. So that's two things that we use that before it was print the form, post it or scan it and email it, and that was a big hassle. Now it's instant.
So the website and HAI Connect, it's saving you time, it's saving you money, which means that
And
you
I'm
have...
learning.
And you're learning, yes, new skills. But it means you have the time and the money to then invest in
Do
other things,
other
awareness.
things. Yeah.
And one last mention of HI resources, which I don't think has been mentioned so far, but Jackie, you had a really lovely way that you use HAI as a resource.
Yes, when it comes to these other different kind of things, our Canadian government is very, you have to do it the way they want you to do it. So we have to connect ourselves in Canada. So, but the way I use the resources is anytime I'm in a predicament, I give Tony or Henrik a phone call, and I get a phone call right away the same day. Otherwise, I don't think I'd be in this organization anymore if I wouldn't get these calls back for direction and help. It's been very instrumental. And the other way we really use Global and everything they do, or HAEA, is like after the walk, the Communal Walk, that's when we launched our surveys. We had a good engagement in Canada, and that's how we managed to get the data for the abstracts this time. Now, this time, we've taken advantage, and Canadians are very competitive. So they really wanted to win this walk. So we had them very connected, and so then we launched our survey for Child Youth, and we had 80% of our membership opening it on the first day because they're quite competitive. So now we're using this global event to launch our Child Youth program here today. So I'd like to, this is very dear to our hearts as our team. I'll try to do this. HAE Canada aims to raise awareness of HAE and connect those patients living with HAE. We are proud to announce the launch of the HAE Canada Derek Scott Simon Child Youth Program. Living with a rare disease is not easy. It can be confusing, frustrating, and scary. It is even harder when you face these challenges alone. Derek, an HAE patient, wanted to create a way to connect young persons across Canada who have been diagnosed with HAE. His goal was a support system for youth all across Canada, where they could connect and communicate with others who could understand and relate to their experiences. Sadly, Derek passed away on HAE Day, May 16, 2012, and did not get to see this goal realized. HAE Canada is proud to honor his memory. Our efforts to join together Canadian youth living with HAE and his parents are here today. I'd like to ask Bob and Judy Simon to stand up. They are members of our board, and it's been 6 years we've been waiting to launch our program.
Thank you very much, Jackie. We're delighted that you've been able to share that with us, and we wish you and HAE Canada and the project all the very, very, very best. On behalf of our whole panel, we're all choking up, on behalf of our whole panel, Janet, Fiona, Jorn, Rachel, Jackie, and Beverly, thank you very much. A big round of applause, please.